technocrats from government, those leaders in the private sector, and of course members of the media who are here. Today we'll also be having sign language services as well. For those who are going live, may we ask you to just give your final countdown to studio? And for those who are about to stream, we'll begin. So the Prime Minister will be joined. She's on her way? And so, ladies and gentlemen, at 8 minutes past 6 o'clock this Wednesday evening, we begin our press conference being called by Prime Minister the Most Honorable Andrew Holness. Prime Minister.
Good evening, everyone. Thanks for coming out at short notice, and thanks for waiting on the Cabinet to complete its deliberations. We know that we are in an emergency situation, but nonetheless, we don't take your time for granted. So again, thank you for your patience. This press conference is a report on the meeting of Cabinet, but it is also an opportunity for the Ministry of Health. The Minister of Health is here with me, and we will be joined shortly by the CMO and the Permanent Secretary in the Ministry of Health, and they will give more updates as to what has transpired since the last time we updated the nation. This press conference is also in keeping with the protocols that we have established, that as far as is possible, we will be giving regular updates to the people of the country. The greatest weapon in the fight against the spread of this disease is accurate information. That is the greatest weapon. And therefore, the government is establishing itself as the source of accurate information. And even if the information is already in the public domain, the government will come and state the positions officially. We have to do this because there is, and naturally will be, though there are some deliberate attempts at misinformation, but there will always be a certain element of panic and fear. It is natural, and we understand. And as we progress through this crisis, we expect that with the stance that we have taken on being accessible, on providing information, that panic and fear will subside. However, we are also confident that all Jamaicans will adjust their behavior by accepting the information that is given and change the way in which they would have normally operated. Change is always difficult, but if we bend our minds to it, like I bent my mind a while ago coming into this room to go to the hand sanitization station, got some hand sanitizer on my hand, and I did my 20-second routine, and I believe I'm good. All right? I'm going to avoid touching my face, something that we always like to do, and I shake a whole heap of hands all the time. But now it's, and people seem to like that. We have to maintain what is called a healthy distance. What is it called, Chris? Social distancing. Hard for us to do. We are sociable people. But they say 1 meter, that's about 3.5 feet, or safer 4 feet away. And those measures should help us to contain. The disease is not a death sentence. In the initial stage, the panic everybody will feel, but we are not saying that be careless and get the disease. That's not what we're saying. What we're saying is that if you follow the recommended procedures, it is highly likely that you will not get the disease. So the personal responsibility is very important. Now, government has some responsibilities as well. And I can't speak to the medical, technical issues. The CMO will speak to those. And neither can I speak with any expertise to the public health issues. The CMO, the Minister of Health, and the Permanent Secretary in the Ministry of Health will speak to those. But government has to declare the overarching policy positions that will set the context within which we all operate. And what I want the public to understand is that you have a government, I'm not even saying now an administration, but you have a government that has a framework set by legislation. There are many laws in Jamaica which controls how we act. You have the Quarantine Act, you have the Disaster Risk Management Act, you have all kinds of laws for which the government must follow. And we
Right to have friends.
My rights are I have a right to
I have the right to drown.
I have the right to be myself.
I have the right to be different.
It is my right to go to the beach.
I have the right to make new things.
I have the right to create.
I have the right to eat.
I have the right to dance.
have the right to good health care.
Good health care. I have the right to be protected from abuse and harm.
I have the right to a quality education.
I have the right to be seen and heard.
Seen and heard.
Seen and heard.
I have the right to take part in the decision making in my home, my school, my community, and my country.
I have the right to be me.
The following is brought to you by MOCA, the major organized crime and anti-corruption agency with kind support of NIA and USAID.
Criminal minds think they are cunning. The major organized crime and anti-corruption agency have them running. Your friend a shout, come scam. Take time running, are we ready for the ops? Drive up on your block, step out now me block, cyber take away your laptop. Pull up every lock, no evidence to drop. We put it in a cuffs and now we have the under lock. Sin you say scam, you better look out fit. When you move corrupt, better look out fit. They say you get wet, look out fit. Look out fit, look out fit. From you say scam, you better look out fit. When you move corrupt, better look out fit. They say you get wet, look out fit. Look out fit, look out fit.
The proceeding was brought to you by MOCA, the major organized crime and anti-corruption agency with the kind support of NIA and USAID.
You'll always remember that day you became a parent. That day, you made yourself a promise to provide for them, to protect them, laugh with them, watch them learn, and let them grow. That day, you realized your biggest challenge lies in bringing them up in a world full of choices. That day, you knew they would grow up fast, and the innocence you cherish wouldn't last. That day, you made up your mind that no matter how things change, you would always take the time to give them parental guidance. That day is today.
Remember, parental controls are available for all devices. A reminder from the Broadcasting Commission.
We can be, we must be, the generation to eradicate extreme poverty, the generation most determined to fight injustice and inequality, the generation that saves the planet from climate change. To achieve this, we must implement Agenda 2030, a 15-year development plan for everyone, everywhere, with no one left behind. We will live in a world where no one, anywhere, lives in extreme poverty.
We will live in a world where no one goes hungry, where no one wakes up in the morning asking if there will be food today.
We will live in a world where no child shall die from diseases we can cure, and proper health care is a lifelong right for us all.
We will live in a world where everyone goes to school, and education will give us the knowledge and skills for a fulfilling life.
We will live in a
It is business meetings, weddings and funerals and Sunday morning church service. We're asking the public, and this is where responsibility comes in, personal responsibility. Government has a limit to what it can do, and that is the nature of our society, and therefore the good civic understanding and good civic leadership has a role to play. In these gatherings and events, we ask that you follow the protocols that have been established for personal care and hygiene, that you have these meetings conducted as efficiently as possible, that you avoid close contact, maintain as far as possible the social space, that's what it is called, the social distance, and do all the things that we have been saying. We are not at the point where we would seek to enforce it. We are enforcing what we can do within the law, and we are therefore asking citizens to use their own discretion. On that note, there are persons who will be traveling to Jamaica from countries that have an increasing infection rate. And there are persons from Jamaica who may be wanting to travel to countries with an increasing infection rate. We would advise strongly against that at this time. Non-essential travel is not recommended. The government is leading by example. No ministerial approval for non-essential travel. In fact, it must be a dire emergency for my pen to go on the paper to say approved for travel. The Cabinet Secretary has also been informed, and therefore the entire civil service is also on that rule, and in fact the larger public sector is on that rule. No non-essential travel. Have I covered everything? Yes. So, generally, I think that based upon the plans that we have had in place, based upon the response so far, we have been handling this crisis fairly well. I must make mention of the financial provisions that have been made by the Minister of Finance, who did an excellent job yesterday in Parliament in presenting a budget that some persons say it was such a well-balanced and well-presented budget. It's a landmark in the financial planning of the country. But what we should also note is that it is a budget that is designed for resilience, and it has taken into consideration the threat that we face for COVID-19. We are in this position today financially because of the sacrifices the Jamaican people have made. The workers, the businesses, the average man and woman. And we are not about to squander it. So we are going to be using the resources in a way to ensure that Jamaica can recover rapidly from this crisis, and that whatever way we can cushion the fallout from the crisis, that we will do our best. And I again congratulate the Minister of Finance for his presentation. The World Health Organization has now declared this a pandemic. And of course, the sense is that it is now a global epidemic. It is in almost every country. And from history, we know that pandemics have certain phases, and we know the measures that should be taken to contain. And Jamaica is doing all of those measures now. And I believe that we have followed the WHO and PAHO. We have followed the standard practices. And in my opinion, when I read their base protocols, we are sometimes over and above. And we are doing that to ensure that we protect the public health and safety. Ladies and gentlemen, I'm sure you have other questions to ask, but I'm going to ask the Minister of Health if he would like to give some overview on the issues that have occurred since his last update to the nation. Minister.
Thank you, Prime Minister. Ladies and gentlemen, first of all, I want to thank the Prime Minister for his leadership and the Cabinet members, many of whom are present here, for the support to the Ministry of Health and Wellness. Of course, the Permanent Secretary and CMO are here, but there are others who are seated in the audience. As the Prime Minister said, this is a matter of utmost importance, and the Cabinet has deliberated and taken some decisions which was announced by him. In terms of the Ministry of Health and Wellness, we continue to track the situation on a daily basis, and we do that not just from the head offices of the ministry, but in consultation with a range of ministry personnel right across the length and breadth of Jamaica, as well as our bilateral and multilateral partners, PAHO, WHO, but also some countries, bilateral partners that we engage in discussions with from time to time. I want to report that from the public health perspective, we have a plan. We have observed the spread of the virus since January, and frankly speaking, it has played out according to our expectations. Initially, it was about how we delay the possibility of it coming here. So it was about prevention, which is why the border protection, patrol, coordination was so important, both our sea and airports. We anticipated that the day would come, because we are an open society, when we would have imported cases that were picked up elsewhere and brought in, and you're now witnessing the second such case, having confirmed that case today. And there is the possibility, because this is a cycle of these types of public health threats, and we see that playing out in a number of countries around the world, over 120 to date, that there is going to be the next phase, which is the community spread, meaning persons who are here passing it on to others who are here within their community. Well, hope not in this room as of now, but hopefully not. In fact, the CMO will speak briefly on a few cases that we now have in isolation. And that may signal, depending on the test results, that spread would have started. We hope not, but we're being as transparent as possible. When that community spread begins, the decisions around how to manage the process have to become a lot more rigid. And the Prime Minister, rightfully, having come out of the discussions that we have had earlier, essentially has given a signal to the country that in anticipation of that, some of these restrictions will have to be tightened and enhanced. So the issues around schools, public gatherings, and so on. And it is for a very simple reason. It is not because we want to restrict anybody's rights to their choices in life. It's a simple reason. The formula for defeating this virus in the shortest possible time is to reduce the risk of human-to-human transmission. That's really what it's about. So the more you congregate, the more you spread. The less you congregate, the harder it is for the virus to spread. And we have to take a proactive, preventative approach as opposed to trying to cure. So that's really the key thrust. And the specifics of that, the CMO could speak for a few minutes and give. The second point and final point I'd make is, and by the way, that is why you would have heard today that Boys and Girls Champs has been canceled this year. We had a dialogue. I know the question will come up. And the reality is that the Champs, as celebrated as it is, and something we hail and we are proud of, also involves significant overseas participation, and from jurisdictions that would definitely tempt fate to be diplomatic, because you increase the risk. That's a more appropriate term. In the meeting today, we're told that CHAM sees up to 5,000 persons from overseas coming to watch. These are persons who are old boys and old girls, or scouts coming to scout new athletes and so on. So Minister Grange, Minister Samuda, myself, sponsors, and the organizers had a really intense discussion, and none of us wanted to see this decision taken. We understand and appreciate the disappointment, but the reality is it would increase the risk substantially. And what we want to do is to go through the cycle quickly, Because how these viruses work, they start, they reach a point, and then they decline. You don't want that life cycle to be extended, which is why some of these decisions are important. The final point is on the hospital and the public health system and infrastructure. And I want to say to the country, again, with the support of the Honorable Prime Minister, the Cabinet, the Minister of Finance, who spoke to some of that in his well-presented presentation yesterday, that the government has signaled its absolute commitment in terms of resource allocation and expenditure to ready our public health system to deal with the consequences of internal spread. And we are actively engaged now in procuring additional supplies, training our staff members, ensuring we have medicines, equipment, ventilators, beds, all of this in anticipation that if the model plays out the way we expect, we're going to have to see some hospitalization. So we want to reassure the country. It's time for us we need to appreciate the numbers for what they are. No need to panic, just a need to be concerned and to take care as we champion this particular cause together. The final 30 seconds is to say to you that one of the things that the country will have to discuss and understand is the numbers dissected. Even though we have said that up to over 1 million persons may actually be affected by the virus, once you have internal spread, only a very small percentage of that number is likely to be so affected that they would require hospitalization. In fact, the vast majority of persons will have a common cold, a little orange juice, a few multi-symptoms, some rest, and they'll recover. Nobody wants to be sick, so we're not trivializing the risks, but we do not want the country, I certainly don't want the country to think that the introduction and the spread of the virus means that the demise of an entire population and nation. Because that's not the experience in other countries. It's certainly not going to be the experience here. So we want to minimize the risks, but we want Jamaicans to recognize that it's not a death sentence. So let us approach it in a way that will overcome without having to panic. I'm going to ask the CMO now to do a 5-minute presentation. Thank you.
Thank you, Minister, Prime Minister, ministers, other distinguished persons that are here, members of the audience, colleagues. I'm just going to give you an update as to where we are now in terms of our monitoring of persons that have been coming into the country. So up to now, since the 23rd of January, we have seen about 260 persons that have come into the country that we had designated as persons of interest, meaning that they have traveled to a destination where there has been enough transmission that we were suitably concerned in the last 14 days before their arrival. 65 of those persons were not landed. About 130 of those persons were sent home to be monitored at home. And of those persons, the majority of them have completed their 14 days of observation, and right now we have just about 8 of those that we are monitoring at home. For the persons that we have admitted to quarantine facilities, and this is because we had identified a risk, and a higher risk in these persons, or it was that we found that they did not have suitable facilities to be monitored at home. For those persons, we have sent home about 18 of those persons, and we presently have about 38 persons. We have 38 persons who are presently being monitored in facilities. We have 2 persons that are being monitored in hotels, and we have 7 persons that are now in isolation. This includes the 2 persons that we have had a positive test on The other 5 persons are at other hospitals outside of the university hospital, and those persons, the samples are being collected. They are going to be tested, and by tomorrow we should have a result where those are concerned. So we have 2 persons that are now considered to be imported cases of the COVID-19 in country. What does that mean for us? Prior to this, our main strategy was in terms of delaying in time for us to prepare, delaying with time for the world as a whole to provide some remedies in terms of vaccines and antiviral preparations that would be useful for us here in Jamaica. Now that we have 2 imported cases and the possibility of more imported cases, as well as the possibility of local transmission, our strategy is really aimed at containment. How do we prevent the spread? Now, there's a lot of work that is on the ground now in terms of the Public Health Department, in terms of tracing these persons. And what we want to encourage at this time is full cooperation on the part of the public. The Public Health Department will be contacting several persons, and they will be offering advice because different persons will be dealt with differently. Persons we identify as very close contacts, those persons will be quarantined. Persons that we define as very casual contacts will be quarantined at home, more than likely, because we have to consider the capacity to monitor persons in facilities. And so the priority in terms of monitoring persons in facilities are going to be those persons that we expect to have the most risk. Now, we know that there are a lot of persons who are concerned about, we've gotten a lot of calls and queries in terms of they have been in contact with persons of interest who may have been asymptomatic at the time. We are encouraging persons that have concerns to call the Ministry of Health at the 888 One Love number, and we will offer guidance. We will also be putting out press releases with other numbers that persons can contact us so that we can advise how it is that you are to proceed. We want to be able to help everyone in terms of making the decisions that are right for themselves, for the health sector, and for the general population. So we encourage you to call and let us know your concerns so that we can deal with them. In terms of the general public, the measures in terms of infection control practices remain paramount in terms of stopping transmission. We are advising that persons do not travel if it is not essential. We are also advising that persons who are sick stay at home. If it is that you are out in the public space, then of course you must take the necessary measures in terms of avoiding crowds. If it is that you have a cough or sneeze, then you should cover that with a tissue and dispose of it. You need to wash your hands regularly. Use hand sanitizer if you're not able to wash your hands immediately. But if your hands are visibly soiled, it is of paramount importance that you wash your hands. Infection control measures are what are going to stop the transmission. And simple though they may seem, it is very important that these are adhered to. Persons that have prolonged illness, who are sick, not getting better, must seek medical advice. Okay, and again, I advise persons to call our numbers so that we are able to give that advice. I just want to say, in closing, a word to our healthcare providers. This is a very challenging time for all the persons who are on the front line. We have spent the last couple of weeks preparing for this. This has not taken us by surprise. We have been proactive in our preparations. We have done quite a bit of training, and persons are armed with information. We now need to execute that. We know that it is challenging. Sometimes it is that the public is not easy to cope with, especially when our facilities become overcrowded. And we ask the public to bear in mind that the healthcare professional is also under extreme pressure. They have to deal with queries, they have their own concerns, just like other members of the public. They have their own concerns in terms of how disease is transmitted and how it is that they take precautions. Many of these personal protective gear are not easy to wear. It is challenging all around. And so therefore we ask persons to comply, and I just want to encourage our healthcare professionals at this time. We have a duty and a responsibility. We're not going to shrink from it. And I therefore would say that I think the Ministry of Health and Wellness is here to support every practitioner as much as we can. So we are available and we are coming out. We have been out there in public facilities to advise and to prepare. And you will see more of the Ministry of Health persons out there trying to offer advice and to enable the coordination of our response to this crisis. Thank you.
So we're, Permanent Secretary, would you want to add anything? And I'm sure you'll have many words to add to the questions that are about to come. So we're open for questions related to this matter. And of course, it is news time, so that's the point. So we want to be very quick and efficient. Naomi, you.
Yes, if you could raise your hand, we'll acknowledge you. Once we do, then you'll have a microphone. We acknowledge Siobhan. Identify yourself and your media house and question, please.
Good afternoon. Siobhan Campbell, Nationwide. The question is regarding the confirmed imported case. Was this person a passenger on the same flight as the first confirmed case?
One quick follow-up, and that's it, yes?
Yes, just one other question. Regarding the 2 cases you say have been isolated in their hotel rooms, is that considered safe, or what is the risk factor associated with those 2 cases?
Thank you, Siobhan.
The Public Health Department, with any kind of quarantine outside of a government facility, there are guidelines that have been put in place, written, documented guidelines. The Public Health Department meets with the hotel staff as well as with the individuals concerned, and the monitoring is put in place, whether it is by staff in the hotel, but it is supported by staff from the Health Department. So it's a very comprehensive monitoring that we do. Yes.
Thank you, Simo. Dashan, TVJ.
Sorry, good afternoon. Just 2 quick questions from me. One, in terms of testing for the virus, what is the status on the availability of test kits? And 2, we've been seeing a lot of rumors flying around today about the case out in Bull Bay, about people not being taken in early enough, about students going to school today. Can you clarify from the government's perspective the steps that were taken to ensure that people who were exposed to patient 0, the first patient in Bull Bay, were not going out to expose other people?
Well, in terms of the first, I just want to recognize the support of PAHO, WHO, in increasing our capacity to do tests. Jamaica is one of the first countries in the Caribbean, through our National Influenza Center, that has been able to do testing in country. So, in addition to the kits that we have received from PAHO, we have firm commitment of another set of kits that are to arrive shortly. And in addition to that, we have sought and have received confirmation of support from the CDC in enabling testing in Jamaica. So right now, we do not perceive that there is a shortage. We are following our testing protocols. However, those testing protocols will change as the number of cases increase. With regards to our contacting or tracing of individuals that are affected, our priority in these kinds of investigations is really to identify the persons of highest risk. Okay? And as soon as we received information of the confirmation of the case, and even before, because from the person came into facility, we started our investigations, and we had persons on hold, family members, persons within the household on hold, staying at home, waiting for the confirmatory test. And once that confirmatory test was revealed, then those persons, efforts were made to bring those persons into facility. Now, there are widening circles of that contact that we are going through that process now. It is true that we are not going to reach everybody immediately, but we perceive where the greatest risk is. We certainly have filled that gap, and now we look at the low risk cases. And it is in that stead that we appeal to persons once the information is out in terms of making the contacts, that is followed through. And we expect that we will get full cooperation from the public in this matter.
Thank you, Doc. Next question beside Dashan, your colleague. Your colleague has the mic, though.
Just to clarify, so you're saying the rumors that students were going to school, that is not true?
We are not aware of persons who are of high interest to us being exposed like that.
Spencer?
Good evening, Spencer Darlington, RGR Gleaner Communications Group. My questions are from a sporting perspective. What level of consideration was given to the Boys and Girls Championships being staged without spectators? And my second question, given that there will be a ban, no permits issued in the next 14 days for public gatherings, what does that mean for the status of racing at Caymanas Park, for example?
So bear in mind how I had phrased it. So any event that requires a permit, so that is within the legal authority, remit of the government, those will not be issued. Now, I'm certain that whilst racing has some general licensing, that would not be considered because that is a regular event operated privately. That would fall in the realm of what we have asked. Yes, but not for events that are not regularly planned. The same considerations, however, would have to be brought into play by the operators. They would have to make that judgment given the context in which we are operating. We as a government, by virtue of having press conferences like these, we communicate to the public the seriousness of the event, the seriousness of the threat, and we expect that persons in their private capacity who are operating, for example, racing, would make a decision. In the same way, for example, that some private companies assessed the risk and decided that they would take certain actions in preservation of the health of their staff. We, as this crisis progresses, will give other directives. Let us say that the situation escalates, then clearly we would have to give other directives. But as it is now, we are taking action with what we have within our legal remit to do, which is not to issue permits, and those that have been issued will be rescinded and revoked, and we issue a general guidance, a strong advice that if you have to keep things like funerals, weddings, church, for example, on Sunday, that we exercise our discretion and good sense in these matters.
Prime Minister and ministers, given the time and news time coming up.
So let me be clear. Church, I should be the one saying that. Yeah, but I mean the question asked about racing, about football. No, well, Minister Grange is here and Minister Tufton were both in that meeting. that they will consider, they will give you a response. We discussed the whole issue of football, and whilst we did not have a direct conversation about racing, we agreed on the principle that if the promoters wanted to, say, for example, have their football match without spectators, or have racehorse without spectators, that's something that we would fully endorse. In fact, we would think that that is a publicly responsible thing to do, and we encourage that.
All right, in the interest of time, Prime Minister and Ministers, we'll take 2 more questions. Nicoy at the back.
Nicoy Wilson from the Gleaner. Are the primary reasons why the government has not sought to impose a travel ban on the US and the UK because of economic fears and quarantine capacity concerns for returning Jamaicans?
All right, so the decision around travel restriction on different countries is based on a number of factors. First of all, the virus is present in over 120 countries, so that reason is not as significant anymore. Otherwise, 120 countries would be banned or restricted. More importantly, it is about the extent to which the virus is present in that jurisdiction, and that is juxtaposed against the size of the jurisdiction, the country. Very importantly also, it's a function of the rate of spread, because every day we get up, we monitor, and we know that over the last 24 hours in this country, 100 more persons have been reported infected, because there's a reporting mechanism which requires countries to report all the way up to the WHO, and the WHO then places that out. And if the rate of spread is very aggressive, it is an indication of the success or lack thereof to monitor, to control, or to contain, which is what we aim to do once we have the virus in the country. And by extension, therefore, the risk. There are other factors also, and you mentioned them, to the extent that there are other important variables that are linked that link both countries. So the United States, for example, reality is that we depend on different types of relationship with that jurisdiction. Trade relations, for example. A lot of imports, whether it's material, medicines, food, or otherwise. Those have to be placed in the consideration as part of the risk assessment, and then ultimately a decision is made. In the case of the United States, if you look at the rate of spread and where the virus is, there are some areas that are far more challenging. New York, for example, is a sort of epicenter of where the virus is spreading, and spreading fast. So what we have done in public health is to examine to what extent we can offer advisories, not just about a country, but areas within a country, considering all the other factors that are important in terms of what we depend on as a country also. The UK is very worrying, to be totally frank. The 2 cases that we have were imported from the UK. We are concerned about the rate of spread, and there may have to be some decisions which I'm not going to try to take on my own. I'll depend on the public health team, and of course we'll reference that to the cabinet in terms of making those decisions. Thank you.
Thank you, Minister. As we prepare for the final question, Prime Minister, a number of persons on social media have been asking for clarity concerning the imposition on schools and the opening of schools. Oh, I'm sorry, that was your final question too. All right, so Prime Minister can respond and we can wrap up.
In these matters, as Minister Tufton had pointed out, controlling gathering and movement are critical tools in bringing under control and having success in the reduction of the spread of the infection. And therefore, long before the confirmation of our first 2 cases, we had developed a plan for, in the event it becomes necessary, suspending school operations. The plan has been approved by the cabinet. We have some areas of consultation, I call them, but it is more notice that we would want to have done before we actually announce any such suspension of schools. There are many considerations that we have to we have to put into the equation, fine-tune. One of them being giving parents enough time to make provisions for their children who would be at home in that eventuality. And the second one, students who have examinations coming up, we have to see how best we can continue to provide their tutoring and lessons. And there are options for that to be done online, to use public broadcasting, to use radio, for example, and those options are now being fine-tuned. So I would want this to be considered as notice that this could happen. In other words, the government could have come 2 days hence, a week hence, and just say all schools are closed. And then we would have had the concern being raised. We didn't get notice. What am I going to do with my child? So we thought about it very carefully, and we thought it best to indicate. Right? So in the event that it becomes necessary, the public is already informed. It is in the back of their minds. They have to start making those kinds of consideration. As we close, as it relates to churches, just to say that the government is not saying that, church mustn't keep Saturday or Sunday, Sabbath or Sunday. That's not what we're saying. We are asking church leaders, and I have seen where many churches internationally have decided that they're going to keep their services online. And we're asking that the church leaders consider some of these novel methods of still worshiping, because prayers are also very important, absolutely important, as the country goes through this crisis. But we appeal to them to take the necessary measures. Now, in terms of patient zero, that's what we term, that is the first person to have the infection. They traveled to Jamaica on BA 2263, and there would be many other persons on that flight. We think it is in the public's interest, and I'm going to give the date shortly, the 4th of March, that other persons who entered Jamaica on that flight be aware. And what we ask them to do is to self-identify. That means the number that is given by the Ministry of Health that they should call in to say, I am on the flight and I am okay. Or I am on the flight and I feel a little fluish. So that we are aware and they are aware. We, by virtue of the flight manifest, we will be seeking to make contact. Now we know that not all information given could be accurate. Some people may have made a mistake in their address and we can't reach out to them or find them. So it is important that they self-identify. Now, if it is that they are, they match the case profile or they have symptoms, the Ministry of Health will respond to them, right? And so we are taking the approach that it is best that we give people the information. So persons who came in on flight BA 2263 on the 4th of March, we are asking you to, the Minister of Health will tell you the number. Sorry, social distance.
8881 love.
It's
8. Okay, so the number we have now, 8881 love. You must remember one love. ONE-LOVE, 8881 love. And we'll advertise others.
Right, so if you call that number and just update us as to your status, and we will respond to you if it is necessary. Well, the Minister of Finance is making an important point. The case was confirmed, brought to our attention, and confirmed on the 10th, which was yesterday. And of course, that would have been within the 14-day period of incubation. So we will do the same thing for the second as soon as
we'll advertise it.
we have the information. So ladies and gentlemen, thank you.
Prime Minister, we thank you. Ministers as well. For those who are on social media, Minister Tufton will continue the dialogue. He will have a Twitter or a social media town hall in a few minutes, and you can ask further questions there. May I thank members of the media, all members of the Ministry of Health, certainly cabinet ministers and everyone else, the permanent secretary here at the Office of the Prime Minister. Thank you all for your attention, and a very good evening to you.